Hello. Hello.
Hello, ma'am.
Good afternoon. Hello.
Hello, ma'am.
Ma'am.
Okay.
Yes, ma'am.
Hello. And Trisha. Hello. Sorry, Liji.
Ma'am. Yes, ma'am.
Same problem. നിങ്ങൾക്ക് ഇഷ്യൂമാണ്.
ഞാൻ വരുന്നു ഞാൻ
Okay. Good afternoon, everybody.
Good afternoon, ma'am.
Okay, can you see the slides now?
Yes, ma'am.
ഭയങ്കര എക്കോ ഉണ്ടോ?
Ma'am, echo ഉണ്ട്.
Okay, shall we start the class? എത്ര പേരുണ്ട്? എല്ലാവരും ഉറക്കാണോ? ഹലോ, ലിജി പോയല്ലോ.
Hello, ma'am.
Okay, I will give you the slides. Okay, after this class. I don't know whether it will be clear or not. Anyway, I'm starting the class. We are dealing with the environmental physiology. It's a part of respiratory system. Okay, respiratory system. Okay, you have learned about the regulation of respiration, oxygen transport, everything. So this environmental physiology is mainly, it will be easy when you have studied all these things. Have you read the oxygen transport, carbon dioxide transport regulation? Have you studied? പഠിച്ചിട്ടുണ്ടോ എല്ലാവരും? ഹലോ, ഇടയ്ക്ക് ആരെങ്കിലും ഒക്കെ ഒന്ന് റെസ്പോണ്ട് ചെയ്യണേ. കേൾക്കുന്നില്ലെങ്കിൽ പറയണം.
കേൾക്കുന്നുണ്ട് മാം.
Okay. Okay, environmental physiology. Under this, you have to learn two things. One is high altitude physiology, and the another is diving physiology. Okay. So high altitude physiology, you are learning about the physiology of high altitude, where you have low atmospheric pressure. Okay, in diving physiology, you have you are learning about the physiology under high pressure. Okay, under depth you have high atmospheric pressure, and that is physiology of high barometric pressure. That is diving physiology. Okay, so we will start about the high altitude physiology. First, you have learned this atmosphere about about this atmosphere, different layers of atmosphere during your +2 classes, isn't it? Yeah, it is divided into troposphere, stratosphere, mesosphere, thermosphere, exosphere, like that, isn't it? Troposphere is up to 18 kilometers. And the atmosphere is the space where the atmosphere is divided into these layers, and we are learning about the high altitude. How this high altitude, what is meant by high altitude? High altitude is any height above 5,000 feet. But classically, high altitude is defined as any height above 10,000 feet. Okay, because up to 10,000 feet, you don't feel any symptoms of hypoxia. Beyond 10,000 feet only, you get symptoms of hypoxia. So classically, high altitude means height above 10,000 feet. Okay, but any height above 5,000 is considered as high altitude. And these are different layers of high altitude. 5,000 feet, 8,000 feet, and 11,500. It is divided into different layers. Between 11,500 and 18,000 is very high altitude. And beyond 18,000 feet, up to around 30,000 feet, it is extreme altitude. Okay, and 18,000 feet is the height at which maximum height at which permanent inhabitation is possible. And AMS, it is written as AMS can afflict tourists at 18,000 feet or above. AMS means acute mountain sickness. Okay, that we will learn later. These are the altitudes. And what is the problem at high altitude? At if you go to high altitude, you can see that the composition of air remains constant from sea level up to 30,000 feet. Okay, and on ascent, what is happening? Barometric pressure decreases, and which is reflected on partial pressure of oxygen and nitrogen mainly. Okay, not much effect on carbon dioxide partial pressure. And this partial pressure of water vapor is 47 millimeters of mercury at normal body temperature. It will remain same at high altitude to some extent. And partial pressure of carbon dioxide also remains constant unless there is some alteration in respiration. Because partial pressure of carbon dioxide is depending mainly on the metabolic activity in your body or tissue cells. Okay, isn't it? So the partial pressure of carbon dioxide is remaining almost constant unless there is some alteration in respiration. Alteration in respiration means hyperventilation or any alteration in ventilation. Okay. And you can see that the atmospheric pressure is getting decreased when you go to high altitude. Okay, so at the sea level, if it is 760 millimeters of mercury, it will be decreasing when you go to high altitude. And just we will see, and what is the main problem when you ascend to a high altitude or when you ascend on a mountain like Mount Everest or Himalaya, like that? The only gas which has effect on the body is oxygen. Okay, so when the partial pressure or when the atmospheric pressure decreases, the only gas which has effect on the body is oxygen. And effect of high altitude is mainly due to decreased partial pressure of oxygen, and that is called hypoxic hypoxia. And this is described by Paul Butt, who described that the effect of high altitude is only due to decreased partial pressure of oxygen. And hypoxia is, what is hypoxia? Have you learned that hypoxia? Hypoxia is oxygen deficiency at tissue level. But what is hypoxic hypoxia? Hypoxic hypoxia, or it is also known as hypoxemia. It is due to reduced arterial PO, partial pressure of oxygen. Okay, so hypoxia is oxygen deficiency at tissue level, which can be due to different causes. And of which one cause is hypoxic hypoxia or hypoxemia, usually seen at high altitude, and it is due to reduced arterial partial pressure of oxygen. And these are some critical altitudes. You can see the 10,000 feet is important because no or only some symptoms of hypoxia occurs at 10,000 feet. And 18,000 feet is a height at which permanent inhabitation is possible. And more than 20,000 feet, hypoxia can endanger life unless the person is breathing oxygen or supported with oxygen. And 35,000 feet is the height at which usually these modern aircrafts fly. Okay, so 35,000 feet, if the aircraft is having some problem and the cabin pressure is suddenly lost, what will happen? That person will be exposed to severe hypoxia. Okay, that is the importance. And above 40,000 feet is the ozone layer. And next is, this is a slide showing the barometric pressure and partial pressure of oxygen. You can see okay, can you hear me?
Yes, ma'am.
So this is, here you can see the chart showing alveolar partial pressure of oxygen and partial pressure of carbon dioxide at different altitudes. Okay, here the partial pressure of oxygen is getting, you can see that partial pressure of oxygen in the alveoli is getting decreased when you go to very high altitude. And what is happening here, when you go to around 30,000 feet, the alveolar partial pressure of oxygen is only 18 millimeters of mercury. These values just to show you the decrease in partial pressure of oxygen. You need not by heart these values. You by heart the alveolar PO2 at the sea level. That you should know. It is 104 millimeters of mercury. Okay, and partial pressure of carbon dioxide, alveolar PCO2 at sea level is 40 millimeters of mercury. And arterial oxygen saturation also you should know, at sea level it is 97 and it is getting decreased when you go to high altitude. Okay, and this is another diagram showing alveolar partial pressure of oxygen. And alveolar partial pressure of carbon dioxide and arterial oxygen saturation under two conditions. One is breathing air and the other is breathing pure oxygen. When you breathe pure oxygen, you can see that this alveolar partial pressure of oxygen is remaining at even at 139 millimeters of mercury up to 30,000 feet. It is getting decreased only beyond 39,000 or when you reach 40,000 feet. Okay. When you breathe pure oxygen or 100% oxygen is given to the subject when he is ascending to high altitude. Okay, you can maintain the alveolar partial pressure of oxygen up to 30,000 or 39,000 feet. But beyond 40,000 feet, you can see that the person will be exposed to severe hypoxia even when he is given oxygen. Okay, even when he is given oxygen beyond 40,000 feet, hypoxia will endanger your life. Okay. And this is another diagram showing hemoglobin saturation at different altitudes. Here also you can see that it is decreased when the person is not supported with oxygen. There is sudden fall in hemoglobin saturation up to, and it is less than 70 at 20,000 feet. Okay, that blue line is or when the person is breathing air. Hemoglobin saturation when the person is breathing air. But red line shows that hemoglobin saturation when the person is breathing pure oxygen. In that, you can see that up to 39,000 feet, the hemoglobin saturation is remaining above 90%. Okay. And what are the factors producing changes in the body at high altitude? What are the problems when the person is exposed to low atmospheric pressure? There is hypoxia due to the decreased barometric pressure. And another problem is expansion of gases and fall in atmospheric pressure and effect of light rays. Of this, most important is the hypoxic hypoxia. And hypoxic effects at high altitude depends upon three factors. One is the level of altitude, and second is the rate of development of hypoxia or speed of ascent. And third factor is duration of exposure to hypoxia. First one is the level of altitude. Etra height lana irikkunnathu pinne rate of development of hypoxia. Adayathu nammal etra speed il aa height il ettunnu. Appo oru divasam kondu oru 30,000 feet like poyitunnengil atrayum rapid aayitana you are exposed to hypoxia. Okay, so that is speed of ascent. And third factor is duration of exposure and how long you are exposed to that much hypoxia. Okay, these three factors are important. And next is effects of barometric pressure and partial pressure of oxygen at different altitudes. What are the effects? See, there are 4 stages of hypoxic hypoxia can occur depending upon the partial pressure of oxygen. Okay, when the partial pressure of oxygen is remaining above 60 millimeters of mercury, there is no much symptoms. Okay, no symptoms of hypoxia, and that stage is called the stage of indifference. Okay, and second stage, that is seen up to 10,000 feet. I told you up to 10,000 feet it is considered to be safe because no symptoms of hypoxia is seen as the partial pressure of oxygen is remaining above 60 millimeters of mercury. And second stage is stage of reaction. It is seen above 10,000 feet where you get moderate hypoxia because the partial pressure of oxygen is falling between 40 and 60 millimeters of mercury. And at this stage, you will have some symptoms of cardiovascular and respiratory system. Okay, some cardiovascular symptoms like tachycardia, hypertension like that you will get, and respiratory symptoms like hyperventilation is seen. And also some early CNS involvement will be seen, and that will also cause some symptoms of irritability, insomnia like that. Okay, so that is stage of reaction. And next stage is stage of disturbance. Third stage is seen between 15,000 and 20,000 feet where the partial pressure of oxygen falls between 30 and 40 millimeters of mercury, where you have severe hypoxic symptoms, severe hypoxia with CNS, central nervous system involvement. That neurological involvement is aggravated. And finally, it is the critical stage. And the critical survival altitude is 23,000 feet, where survival is not possible without oxygen. And above 30,000 feet, severe hypoxic symptoms even with oxygen therapy. Okay, these are the clinical types of hypoxia you can get. 3 types: fulminant hypoxia, acute hypoxia, and chronic hypoxia. Okay, that we will learn in hypoxia. I think it will be taught to you in the next week. Hypoxia, there is a separate class for you. Next, we will see what are the physiological compensatory responses to hypoxia seen at high altitude. When a person ascends to a high altitude, there are 3 types of compensatory responses seen. Okay, and these 3 types of responses are: one is accommodation, and second is acclimatization, and third one is adaptation. Acclimatization important ആണ്, short essay ആണ്, short essay long essay ആയിട്ട് ചോദിക്കാവുന്ന question ആണ്. Okay, ശ്രദ്ധിക്കുന്നുണ്ടോ ആരെങ്കിലും, അതോ എല്ലാവരും ഉറങ്ങുകയാണോ?
ശ്രദ്ധിക്കുന്നുണ്ട് മാം.
Okay. And first one is accommodation. What is accommodation? It is the immediate reflex adjustments of respiratory and cardiovascular systems to hypoxia. So accommodation is the immediate reflex adjustments of respiratory and cardiovascular systems to hypoxia. Sudden response ആണ്. നമ്മൾ പെട്ടെന്ന് ഒരു low partial pressure of oxygen, when you are exposed to low partial pressure of oxygen, the immediate mechanism is called reflex mechanism is called accommodation. And what are the reflex responses seen? First and most important response will be hyperventilation. Okay, when you are exposed to low oxygen tension or low partial pressure of oxygen, what will be the first response? It will be hyperventilation. അല്ലെ, ഓക്സിജൻ കുറഞ്ഞാൽ നമ്മൾ എന്താ ചെയ്യാ? നല്ലോണം വായ തുറന്ന് ശ്വാസം വലിക്കും അല്ലെ. ദാറ്റ് ഈസ് എ റിഫ്ലക്സ് മെക്കാനിസം. നമ്മളൊരു സിമ്പിൾ ആയിട്ട് ആലോചിച്ചാൽ മതി. ഒരു കുന്നിന്റെ മുകളിൽ കയറുമ്പോൾ നമ്മൾ ആ കയറുന്നതിന്റെ എക്സേഷൻ കൊണ്ട് മാത്രമല്ല, to 3 dpg. Okay, so these are the accommodation reflex responses seen during accommodation. Okay, next is the acclimatization. Very important. Short note item, physiological basis ആയിട്ട് ഒക്കെ ചോദിക്കാവുന്നതാണ്. Okay, take down these points. എഴുതിയെടുക്കാൻ പറ്റുന്നുണ്ടല്ലോ അല്ലെ?
ഇല്ല മാം, സ്പീഡ്.
Ma'am, can you show the previous slide?
Accommodation. ഇതെല്ലാം നിങ്ങൾ പഠിച്ച സാധനങ്ങളല്ല. റെഗുലേഷൻ ഓഫ് റെസ്പിറേഷൻ കഴിഞ്ഞതുകൊണ്ടാണ് ഇത്രയും ഞാൻ സ്പീഡ് ആയിട്ട് പറഞ്ഞു.
മാം സ്ലൈഡ് അയച്ചു തരുമോ മാം?
തരാം. ഓക്കെ
Okay, ma'am.
ഓക്കെ, പറ്റുന്ന പോയിന്റ്സ് ഹെഡിങ്സിൽ എഴുതിയെടുക്കണം കേട്ടോ. Okay, so what is acclimatization? Definition is important. Definition ഇങ്ങനെ തന്നെ എഴുതണം കേട്ടോ. It is defined as physiological changes that occur due to prolonged or repeated exposure to a particular stressful environment. That is called acclimatization. Physiological changes that occur due to prolonged or repeated exposure to a particular stressful environment. ഒരു പർട്ടിക്കുലർ സ്ട്രെസ്ഫുൾ എൻവയോൺമെന്റിന് കുറെ നാള് അല്ലെങ്കിൽ റിപ്പീറ്റഡ് ആയിട്ട് നമ്മൾ അതിനോട് എക്സ്പോസ്ഡ് ആകുമ്പോൾ നമ്മുടെ ശരീരത്തിൽ, നമ്മുടെ ബോഡിയിൽ ഉണ്ടാവുന്ന ഫിസിയോളജിക്കൽ ചേഞ്ചസ്, അതാണ് അക്ലിമാറ്റൈസേഷൻ. Okay, and this in this graph you can just see what are the effects. When the first diagram you can see there is a when a person is ascending to a high altitude, there is a rapid drop in fitness. പെട്ടെന്ന് നമ്മളൊരു ഹൈറ്റിൽ എത്തിക്കഴിഞ്ഞാൽ അവിടെ നമുക്ക് പെട്ടെന്ന് ഒന്നും നമുക്ക് പെർഫോം ചെയ്യാൻ പറ്റില്ല, അല്ലെങ്കിൽ നടക്കാൻ പോലും പറ്റാതെയാവും. അതാണ് റാപ്പിഡ് ഡ്രോപ്പ്. ഫസ്റ്റ് റെസ്പോൺസ്. Okay, high altitude there is a rapid drop in fitness. And in the second diagram you can see there is a when the person is exposed to that environment for a few months or few days or few months, what will happen? That fitness level will begin to increase. Okay, that is acclimatization begins at this stage. And in the third diagram you can see that after successful acclimatization the person's fitness level increased to the a particular level and will remain at that constant level. Okay, and what are the changes you see during acclimatization? Very important. Ella points എഴുതണം, എന്നാലേ മാർക്ക് കിട്ടുള്ളൂ കേട്ടോ. The first and most important point, most important physiological change occurring in your body is increase in pulmonary ventilation. Okay, how this increase in pulmonary ventilation is occurring? What is the mechanism beyond this? First, when you are exposed to low partial pressure of oxygen, that is hypoxia. When you are exposed to a hypoxic condition, what will happen? There is immediate stimulation of arterial chemoreceptors. Which are the arterial chemoreceptors? What is the name of that chemoreceptors? ആർക്കും അറിയില്ലേ? Which are the chemoreceptors?
Carotid body and aortic body.
Okay, aortic body, carotid body and aortic body. So they will be stimulated. So immediate stimulation of arterial chemoreceptors, and that will result in hyperventilation. And this alveolar ventilation will be increased to 1.65 times. Okay, important. Immediate response is 1.65 times increase in ventilation. Okay. And after that, what happens? When there is increased ventilation, what is happening? Carbon dioxide is washed out from your body. Okay, hyperventilation means നമ്മൾ ഭയങ്കരമായിട്ട് ശ്വാസം എടുത്ത് വിടുകയല്ലേ. അപ്പോൾ എന്താ സംഭവിക്കുന്നത്? നമ്മുടെ ശരീരത്തിൽ നിന്ന് കാർബൺ ഡൈ ഓക്സൈഡ് എക്സസ് ആയിട്ട് പുറത്തു പോവുകയാണ്, isn't it? So carbon dioxide wash out of this, and that will cause decreased partial pressure of carbon dioxide in your body. and that will resulting in increased pH of the body fluids. Okay, and that what happens next? When there is an increase in pH, that is causing increased plasma bicarbonate and increased CSF bicarbonate, which will inhibit the brainstem respiratory center. So what is the first? What was the first response? There is increase in ventilation due to decreased partial pressure of oxygen or hypoxia. Hypoxia stimulates chemoreceptors and producing hyperventilation. But after, when there is hyperventilation, what will happen? The carbon dioxide is washed out, and that will increase the pH of the body fluids, and that will cause increase in bicarbonate level, which will inhibit the brainstem respiratory center. ഇതെല്ലാം റെഗുലേഷൻ ഓഫ് റെസ്പിറേഷനെ ബേസ് ചെയ്തിട്ടുള്ളതാണ്. അത് വായിച്ചിട്ടുണ്ടെങ്കിൽ ഇത് മനസ്സിലാവുള്ളൂ കേട്ടോ. And finally, what happens? This will resulting in decrease in ventilation. So initial increase in ventilation is now decreased, and this will last for 2 to 5 days. Okay, so this decrease is lasting for 2 to 5 days. And during that 2 to 5 days, what is happening? During that 2 to 5 days, there is metabolic compensation by the kidneys, because you have increased plasma bicarbonate and increased CSF bicarbonate. And this is compensated by the kidney by increasing bicarbonate excretion through urine. Okay, so kidneys will respond or compensate by increasing bicarbonate excretion and decreasing H+ secretion. And this will bring the pH back to normal, and that will cause again the hypoxic stimulation of the respiratory center, or inhibition on the respiratory center is faded away. Okay, and so what happens? Again, there is hyperventilation, or the respiratory center will respond to hypoxic stimulus, and this will cause increase in ventilation to about 5 times normal. Okay, appo aadyam oru 1.65 times e koodiyullu, adu oru 2 to 5 days veendum korayum because of the carbon dioxide washout. And during that 2 to 5 days, what is happening? Metabolic compensation occurs, and that will again cause hyperventilation to 5 times normal. Okay, so this is the mechanism, very very important. Okay, flow chart pole ezhuthi kanja elappu undavum orkan. Manasilayille? Regulation vayichittundengil idu manasilavullu ketta. Next change, physiological change occurring in your body is increase in RBC count and hemoglobin concentration. How this increase in RBC count is occurring? This you have learned in hematology. Blood in the padishana. What is the stimulus for erythropoietin secretion? Most important stimulus is hypoxia. There is a renal sensor which is sensing the decreasing partial pressure of oxygen. So this renal sensor, or the decreased partial pressure of oxygen sensed by the kidneys, will cause increase in erythropoietin secretion, and this will occur within minutes to hours. Okay, and this increased erythropoietin secretion will occur within minutes to hours of exposure to hypoxia, and this erythropoietin will cause erythroid marrow hyperplasia, and that is mainly stimulating pro-normoblast stage. Okay, so normoblast stage is stimulating. So what will happen? Increased red cell production will occur, but it will take around 5 days for the new RBCs to appear in your circulation. Okay, so erythropoietin secretion will occur within minutes to hours, but new RBCs will appear in circulation only about 5 days later. Okay, so this is the mechanism for increase in RBC count, and when the RBC count is increased, naturally there will be increase in hemoglobin concentration. Okay, this is an point, or extra point which is given in your Gano, how this erythropoietin secretion is occurring, how hypoxia causes production of erythropoietin. Hypoxia causes production of transcription factors, which are called hypoxia inducible factors. And these hypoxia inducible factors are made up of 2 subunits, alpha and beta subunits. And normally oxygenated tissues, the alpha subunits are rapidly destroyed. Okay, and ubiquitinated. And what is ubiquitination? All those things you will learn in biochemistry. Anyway, that is alpha subunit will be rapidly destroyed in normally oxygenated tissues. But in hypoxic situation, what is happening? Hypoxic cells, these alpha subunits dimerize with beta subunits, and these will activate activate genes that produce several proteins, including erythropoietin. Okay, so hypoxia correct transcription factors produce hypoxia transcription factors dimerize that will activate some genes, resulting in production of several proteins, including erythropoietin. That is the mechanism of erythropoietin secretion by hypoxia. And increased RBC production will lead to these things. First thing is increase in RBC production will cause increase in packed cell volume, and packed cell volume will be increased up to 60%. And hemoglobin will be increased from 15 gram percentage to 20 gram percentage, and increase in blood volume by 20 to 30%. Okay, these are the effects seen when there is increased RBC productions. Okay, and of this hemoglobin, increase in hemoglobin concentration and increase in blood volume starts after 2 weeks. Okay, and fully developed, it will be fully developed only after many months. When the person is remaining at that high altitude for a long time, this increase in hemoglobin and increase in blood volume will be fully developed only after many months. Okay. And next physiological change is pulmonary vasoconstriction. Another important thing, pulmonary vasoconstriction. How this pulmonary vasoconstriction is occurring? Hypoxia causes generalized pulmonary vasoconstriction, which will lead to increased pulmonary artery pressure. Okay, and when there is increasing pulmonary artery pressure, what happens? There is more even distribution of pulmonary blood flow, which can improve gas exchange. Pulmonary hypoxia varumbo pulmonary vessels ellam constrictive. Vessels constrictive endha sambhavikka? Adinte proximal aayittulla bhagathilla pressure koodum. Okay, so increased pulmonary artery pressure koodum. Pressure koodumba blood nalla force il ella bhagathekkum flow cheyan thodangum, isn't it? Normally there are some areas where the blood flow is minimal or less, okay, or even negligent. അങ്ങനെ ഒട്ടും ബ്ലഡ് ഫ്ലോ ഇല്ലാത്ത ഏരിയാസ് ഉണ്ട് നമ്മുടെ ലങ്സിൽ. പക്ഷേ പൾമണറി വാസോകൺസ്ട്രിക്ഷൻ വന്നിട്ട് when there is increased pulmonary artery pressure, there will be more blood flow through most of the areas of the lungs, and that will help in improving gas exchange. How? That will increase the surface area for a diffusion of gases. Okay, that is called a respiratory membrane, isn't it? Respiratory membrane through which diffusion of gases occurs. And so when there is increasing pulmonary blood flow, that will improve gas exchange by increasing the surface area for diffusion. Okay, so and severe hypoxia, very severe hypoxia, it can lead to pulmonary hypertension and even cor pulmonale. Okay, what is cor pulmonale? You can go and refer. This is the cardiac complication occurring in due to pulmonary hypertension. Okay. And what is the mechanism behind pulmonary vasoconstriction? This is another thing which is an extra point which is from Gano. Okay, if you write this point, you will get extra mark. If you pass mark, points you will get pass mark. But if you write this point also, it will give you an extra mark. Okay, what is the mechanism of pulmonary vasoconstriction? You can see that there are a special type of potassium channels present on the pulmonary vascular smooth muscles, and they are called oxygen sensitive potassium channels. Okay, and on exposure to hypoxia, And hypoxia causes closure of oxygen-sensitive potassium channels in the pulmonary vascular smooth muscles. Okay, pulmonary vascular smooth muscles, a special type of potassium channels are they are closed on exposure to hypoxia. Potassium channels closed in the there will be decrease in potassium efflux. Potassium efflux is decreased. Point stuck. Okay, so closure of potassium channels will result in decreased potassium efflux. When the potassium efflux is decreased, that will cause depolarization of smooth muscles, and that will open certain voltage gated calcium channels. Okay, voltage gated calcium channels are open. That will resulting in calcium influx or calcium entry into the smooth muscle. When there is calcium entry into smooth muscle, what will happen? Smooth muscle contraction or vasoconstriction. Okay, so that is the mechanism. So in pulmonary vessels, there are oxygen sensitive potassium channels. Okay, in where type of potassium channel okay, in pulmonary vessels are responding to hypoxia by causing vasoconstriction, whereas in systemic arteries you get vasodilatation. Okay, that I will tell you later. So pulmonary vasoconstriction was the third physiological change that is occurring in your body when you reach high altitude. Okay, and next physiological change is increase in diffusing capacity of the lung. And how this diffusing capacity is increased? Normal diffusing capacity is 21 ml per millimeters of mercury per minute, and this is increased to 3-fold in case of acclimatization. And what are the causes for this increased diffusing capacity? There is increased surface area of the respiratory membrane due to increased pulmonary capillary blood volume and increased pulmonary ventilation. I told you when there is pulmonary vasoconstriction, there is increased pulmonary artery pressure, and that will cause increased pulmonary capillary blood volume. Okay, and this will resulting in increased surface area of the respiratory membrane, and that will cause increased diffusing capacity. And another factor is increased pulmonary ventilation. This will also increase the surface area of the respiratory membrane, and that will also increase diffusing capacity. Okay. Next factor is increased pulmonary artery blood pressure forces blood into greater number of alveolar capillaries than normally. I told you there are many capillaries in the lungs which are not perfused normally. Under normal conditions, there are some capillaries which are not at all perfused or under-perfused capillaries in your lungs. So when the pulmonary artery pressure increases, that will force blood into these capillaries which are not perfused normally. Okay, so normally perfused cheyyatha capillaries lekkum koodi ee pulmonary artery pressure koodumbo blood flow cheyum. Okay, and angane adupole thanne partially collapse ചെയ്ത അല്ലെങ്കിൽ closed ആയിട്ടുള്ള alveoli ഉണ്ടാവും. അതും hyperventilate ചെയ്യുന്ന സമയത്ത് ആ alveoli കൂടി ഓപ്പൺ ആവും. അങ്ങനെ വരുമ്പോഴാണ് എന്ത് സംഭവിക്കുന്നത്? Total surface area of the respiratory membrane is increased. Appo area for diffusion of gases will be increased. Okay, so this is a mechanism for increasing oxygen uptake. Appo nammade partial pressure കുറഞ്ഞിരിക്കുന്ന ഒരു ഇതാണ് അല്ലെ, ഓക്സിജന്റെ പാർഷ്യൽ പ്രഷർ കുറഞ്ഞിരിക്കുന്ന ഒരു സിറ്റുവേഷൻ ആണ് ഹൈ ഓൾട്ടിറ്റ്യൂഡ്. ആ സമയത്ത് എന്താ വേണ്ടത്? നമുക്ക് മാക്സിമം ഓക്സിജനെ എടുക്കണം, നമ്മുടെ ബോഡിയിലേക്ക് മാക്സിമം ഓക്സിജൻ എടുക്കണം. യു ഹാവ് ടു ടേക്ക് മാക്സിമം amount of oxygen. For that, what all things can be done by your body? These are the mechanisms. Okay, അതാണ് ഈ പറഞ്ഞുകൊണ്ടിരിക്കുന്നത്. ഓക്സിജനെ മാക്സിമം എടുക്കാൻ വേണ്ടി എന്തൊക്കെ ചെയ്യാം? ഇൻക്രീസ്ഡ് പൾമണറി ബ്ലഡ് ഫ്ലോ കൂടുന്നു, പൾമണറി ആർട്ടറി പ്രഷർ കൂടുന്നു, ഈ റെസ്പിറേറ്ററി മെംബ്രെയിൻ സർഫസ് ഏരിയ ഇൻക്രീസ് ചെയ്യുന്നു. Through all these mechanisms, there will be increased uptake of oxygen even with this low partial pressure. Okay, ഈ low partial pressure എങ്ങനെ ഓക്സിജന്റെ uptake കൂട്ടാം അതാണ് ചെയ്യുന്നത്. And what are some circulatory system changes are also occurring? That is, what are the? One is increasing heart rate and cardiac output. This will occur initial or immediate response. And later it will be brought back to normal when the the partial pressure of oxygen or oxygen uptake is brought back to normal, this cardiac output and heart rate will also become normal. Okay, so initially there is an immediate increase in heart rate and cardiac output. And another thing is hypoxic vasodilatation in systemic blood vessels to increase the blood flow and oxygen supply to tissues. Systemic blood vessels hypoxic vasodilatation. Pulmonary vessels, you are getting vasoconstriction in response to hypoxia, whereas in systemic vessels, you are getting hypoxic vasodilatation. This will increase. Why this systemic blood vessels? Why this vasodilatation is occurring in the systemic blood vessels? That will increase the blood flow to tissues, and that will increase the oxygen supply to tissues. Okay. And this increased capillary, another change is increased capillary density in the right ventricular muscle. And another change is polycythemia. We have seen that there is increased RBC count, and that is called polycythemia. And what will happen when there is polycythemia? That will cause increased blood viscosity, which in turn will increase the workload on the heart. And that will lead to cardiac hypertrophy. When there is increased workload, cardiac muscle mass will be increased. That is called cardiac hypertrophy, mainly the ventricles. Ventricular hypertrophy will occur. Okay, as a response to polycythemia. Okay, so these are the circulatory system changes. And what is the mechanism of vasodilatation in systemic blood vessels? We have seen that pulmonary vessels, there is vasoconstriction in response to hypoxia, whereas in systemic blood vessels, vasodilatation is occurring. That is because there is a difference in the potassium channels present in the systemic blood vessels. And the potassium channels present in the systemic blood vessels are called ATP sensitive potassium channels. That part is not shown. So there is ATP sensitive potassium channels. These ATP sensitive potassium channels are actually opened in response to hypoxia. When there is opening of potassium channels, what will happen? There will be potassium efflux. When there is potassium efflux, that will cause repolarization, or that will cause vasodilatation in the smooth muscle or blood vessels. There is smooth muscle relaxation that will cause vasodilatation in the systemic blood vessels. Okay. That is the mechanism of systemic blood vessel dilatation. Okay. And next change, physiological change that is occurring during acclimatization is the cellular and tissue acclimatization. Cellular and tissue changes. What are the changes at the tissue level or cellular level? There is increase in oxidative enzymes in the mitochondria. And there is increase in cytochrome oxidase enzyme level. And increase in mitochondrial density. And increase in myoglobin, which will facilitate movement of oxygen into tissues. Which tissue mainly? Myoglobin will increase oxygen uptake in the muscles, isn't it? And there is increase in capillary density in at the tissue level. Okay, these are the cellular and tissue acclimatization. Increase in oxidative enzymes, increase in mitochondrial density, increase in myoglobin, and increase in capillary density. Okay. And what about the work capacity and exercise at high altitude? Work capacity, you can see that there is generalized decrease in work capacity in almost all the groups of all the muscles at high altitude. Even when there is acclimatization, the work capacity is decreased when it is compared to a person at sea level or low level. Okay, high altitude like the work capacity generally it will be decreased. All groups of muscles, skeletal muscle eduthalum, cardiac muscle eduthalum, the work capacity is decreased. Even when a person is acclimatized to a best level. Etra higher level like acclimatize ചെയ്താൽ പോലും less than 60% okay, work capacity varullu. Okay. And next is that finishes acclimatization. Okay, so you have to write all these points. Acclimatization എന്ന് പറയുമ്പോൾ ഇതിൽ എല്ലാ പോയിന്റ്സ് എഴുതണം. Increase in ventilation, increase in RBC production അതെല്ലാം പറയണം. പിന്നെ വെന്റിലേഷനും പിന്നെ pulmonary vasoconstriction പറഞ്ഞു, circulatory changes, cellular changes. All these changes to be mentioned. And also mention what is adaptation. Adaptation is actually acclimatization happening in native persons at high altitude. അതായത് സ്ഥിരമായിട്ട് ഹൈ ആൾട്ടിറ്റ്യൂഡിൽ താമസിക്കുന്ന ആൾക്കാരിൽ വരുന്ന ചേഞ്ചസ് ആണ് അഡാപ്റ്റേഷൻ. That is usually acquired in a genetic manner. Genetic generationsil കിട്ടി വരുന്ന ട്രാൻസ്മിറ്റ് ചെയ്യുന്ന ട്രാൻസ്പോർട്ട് ചേഞ്ചസ് ആണ് അഡാപ്റ്റേഷൻ. Okay, physiological and genetic changes that occur over a period of years to generations by those who have taken up permanent residence at high altitude. So persons who are permanently residing at high altitude, there are physiological and genetic changes will occur over a period of years to generations. So ഓരോ ജനറേഷനിലേക്കും പാസ് ചെയ്ത് വരുന്ന ചേഞ്ചസ് ആണ് genetic changes ഉം physiological changes ഉം. That is called adaptation. So when you are asked to write about acclimatization, you have to mention adaptation also. Okay, and here acclimatization begins in infancy. And in this diagram you can see the Peruvian and Tibetan persons. You can see their cheeks are reddish because of the increased blood flow on the skin. Okay, and this is how they appear. And there are certain other changes. These changes seen in these natives are increased chest size. Their chest will be barrel-shaped chest to increase the lung volume. Okay, and but their body size is decreased. And there will be large heart or cardiac hypertrophy will be seen. And ventilation is decreased when compared to an acclimatized person. അപ്പോൾ ഒരു അക്ലിമറ്റൈസ്ഡ് പേഴ്സണെ കമ്പയർ ചെയ്ത് നോക്കുമ്പോൾ this ventilation of these natives will be less than that those of acclimatized persons. Okay, and next is low alveolar PO, partial pressure of oxygen, and there is increased pulmonary diffusing capacity and chronic pulmonary hypertension and RVH is right ventricular hypertrophy. And polycythemia will be seen, and there is increased vascularity of heart and striated muscles. Okay, these are the changes seen in natives residing at high altitude. Persons residing at high altitude. Acclimatization എന്ന് പറഞ്ഞു കഴിഞ്ഞാൽ കുറച്ച് നാളത്തേക്ക് മാത്രം ഹൈ ആൾട്ടിറ്റ്യൂഡിൽ പോകുന്ന ആൾക്കാരിൽ കാണുന്ന ചേഞ്ചസ് ആണ്. ഓക്കെ, അഡാപ്റ്റേഷൻ എന്ന് പറഞ്ഞാൽ സ്ഥിരമായിട്ട് അവിടെ താമസിക്കുന്നവര് അങ്ങനെയുള്ളവരിൽ കാണുന്ന ചേഞ്ചസ് ആണ് അഡാപ്റ്റേഷൻ. ഓക്കെ, so that is the difference between acclimatization and adaptation. And what will be the picture of ODC? What is ODC? It is oxygen dissociation curve.
Yes, ma'am.
What are the factors affecting ODC? ആരെങ്കിലും പറ. Factors affecting ODC. ആരുമില്ല. What is meant by right shift? Shift to right. What is meant by shift to right of ODC?
Decreased affinity to oxygen.
Okay, left shift is
Increased affinity towards oxygen.
increased affinity. So what will happen to these persons? What will happen to ODC in these persons who are residing at high
To
altitude?
left. It will to the left.
What is this diagram?
It will move to the
ഈ
left.
diagramത്തിൽ എങ്ങനെയാ വരുന്നത്? Is it
Left side.
shifted to
Left.
left side? Shifted to left side means
Affinity towards oxygen decreases.
affinity to oxygen is
Decreased.
decreased. Shift to left.
No.
Shift to left means affinity to oxygen is increased. Okay. why there is increase in oxygen affinity? In high altitude, you can see that when there is exposed to, when the person is exposed to hypoxia, we have seen several changes, increase in 2,3 dpg, there is increase in ventilation, increased pH, all those changes. Okay. Of this, some changes can cause rightward shift, some changes can cause leftward shift of ODC. Okay, but a net effect, what you are seeing in persons is, in these persons, is a leftward shift, because leftward shift is seen because the oxygen affinity is increased to increase the oxygen uptake at the lung level. Okay, actually leftward shift is not advantageous at the tissue level, because affinity കൂടിയാൽ tissue level oxygen release ചെയ്യില്ല നമ്മൾ വിചാരിക്കുന്ന പോലെ, isn't it? പക്ഷേ ഇവിടെ most important thing is oxygen uptake at the lung level is more important than at the tissue level. So what we are seeing in these persons is a leftward shift of ODC, which will increase the oxygen affinity, and that will favor maximum oxygen uptake in the lungs, from the lung level. Okay. And what about the work capacity? I told you work capacity is generally decreased. In an unacclimatized person, the work capacity, when you are compared to a normal person living at sea level, is 50%, whereas acclimatized person for 2 months, the work capacity will improve up to 68%, whereas work capacity is in natives living at 13,200 feet is around 87%. Okay, then we will see some high altitude illnesses. What is meant by high altitude illnesses? Altitude sickness or mountain sickness is an illness that ranges from mild headache and weariness to life-threatening building up of fluid in the lungs or brain. Okay, but mild symptom severe hypoxic symptoms like pulmonary and cerebral edema vare ulla ranges ulla illnesses ellathinum koodi parayuna perana high altitude illness. Okay, and which are these illnesses? These include acute mountain sickness, high altitude pulmonary edema, high altitude cerebral edema, and chronic mountain sickness. These are the 4 illnesses seen at high altitude. Acute mountain sickness, high altitude pulmonary edema, high altitude cerebral edema, and chronic mountain sickness. And what is acute mountain sickness? Acute mountain sickness is characterized by a symptom complex which occurs in an individual resting at sea level, ascends to a high altitude over a period of 1 to 2 days for the first time. Very high altitude like പെട്ടെന്ന് കയറി ചെല്ലുന്നു 1-2 ദിവസം കൊണ്ട്. നോർമലി സീ ലെവലിൽ താമസിക്കുന്ന ഒരാള് ഹൈ ഓൾട്ടിറ്റ്യൂഡിലേക്ക് കയറി ചെല്ലുമ്പോൾ ഒരു 1-2 ദിവസം കൊണ്ട് ഹൈ ഓൾട്ടിറ്റ്യൂഡിൽ എത്തുമ്പോൾ ഉണ്ടാവുന്ന സിംറ്റംസ് ആണ് acute mountain sickness. Immediate disturbances seen in a person who ascends rapidly. Okay, and what are the symptoms? And these symptoms will appear 8 to 24 hours after arrival at high altitude, and it can last for 4 to 8 days and can occur at any height above 6,600 feet. And what are the characteristic features? There will be headache, nausea, vomiting, irritability, insomnia, and breathlessness. Okay, these are some neurological and respiratory symptoms in response to hypoxia. And in severe cases, there can be cerebral and pulmonary edema. Life-threatening pulmonary and cerebral edema can occur. Okay. And what is high altitude pulmonary edema? This high altitude pulmonary edema can be seen as a part of acute mountain sickness. And what is it? It is due to rapid ascent to above 10,000 feet. And what is the mechanism of development of high altitude pulmonary edema? When there is severe hypoxia, we have seen that there is pulmonary vasoconstriction, and this will cause pulmonary blood flow forced to unconstricted pulmonary vessels. Okay, there are some vessels which are not constricted also in the lungs, and these unconstricted vessels will also get increased blood flow due to the increased pulmonary pressure, and that will resulting in stress failure of capillaries. hypoxia exposed. There will be pulmonary vasoconstriction in most of the areas. Some areas there will not be vasoconstriction. So what will happen is that this increased pulmonary blood flow will be forced to these unconstricted vessels, and that will cause stress failure of capillaries. Okay, these capillaries are there will be failure of capillaries. Failure of capillaries means there will be fluid leak into the interstitial space, and that will result in pulmonary edema. Stress failure on the capillary function fluid leak fluid leak there will be pulmonary edema. Okay, this is the mechanism of development. And we have seen how this pulmonary vasoconstriction is occurring. There is closure of oxygen sensitive potassium channels in the pulmonary vascular smooth muscle, and depolarization of the smooth muscle, and that will cause calcium entry, and that will cause smooth muscle constriction. Okay, and next is acute cerebral edema. What is this acute cerebral edema? It will result from local vasodilatation of the pulmonary cerebral blood vessels. Okay, pulmonary edema pulmonary vasoconstriction cerebral edema reason vasodilatation. Okay, two mechanism orkanam. I told you the difference in potassium channels in the pulmonary and systemic vessels, isn't it? So here what is happening? Exposure to hypoxia causes opening up of ATP sensitive potassium channels in the cerebral vessels, and that will cause potassium efflux and vasodilatation, and this will increase capillary pressure, and that will resulting in cerebral edema. Okay, capillary pressure, that will cause leakage of fluid, and that will cause cerebral edema. Okay. And this cerebral edema is characterized by CNS neurological symptoms like irritability, insomnia. In severe cases, it can lead to death also. Okay. And next is chronic mountain sickness. It is also known as Monk's disease. Okay, this chronic mountain sickness is seen in long-term residents of high altitude, and this is characterized by the exaggerated features of the adaptation changes. We have seen several adaptation or acclimatization changes which are occurring in long-term these persons, and those features, when it is exaggerated or extreme cases of severe hypoxia, this will be damaging to the, or it will cause damage to the tissues, and even it can cause death. And the changes are polycythemia, pulmonary hypertension, right ventricular hypertrophy, fall in peripheral artery pressure, congestive cardiac failure, and death. Okay, so that these are the features of chronic mountain sickness. So that finishes high altitude physiology. And how do you treat all these altitude illnesses? Few points about treatment also. All forms of high altitude illnesses are treated by descent to lower altitude, and by treatment with diuretic acetazolamide, and cerebral edema is treated with glucocorticoids, and pulmonary edema is treated with oxygen therapy, and if available, use hyperbaric chamber. I will show you one diagram of hyperbaric chamber. And another drug used in pulmonary edema is nifedipine, which is a calcium channel blocker that lowers pulmonary artery pressure. Just know these points. Important point in the treatment of high altitude illness is descent to lower altitude. And another drugs which are used are acetazolamide, which is used for alkalosis, and glucocorticoids for cerebral edema, and nifedipine for pulmonary edema. And in pulmonary edema, you have to give oxygen, and it should be given in a hyperbaric chamber, because you are the person is exposed to low atmospheric pressure. So you have to give oxygen at high pressure, and this high pressure, or the person should be exposed to high pressure environment. And this high pressure environment can be provided through a hyperbaric chamber. And this hyperbaric, a special type of bag called gamma bag is used as hyperbaric chamber to treat high altitude illness. You can see this gamma bag, which is a fabric chamber. It can be inflated with a foot pump, and that will cause a great air pressure. Okay, increased air pressure inside the bag. And other effects of high altitude are effects of expansion of gases and decompression. On rapid decompression, then effects of fall in atmospheric temperature and effect of light rays also are also seen. Okay. So that is about the high altitude physiology. And another topic, do you need a break?
Yes, ma'am.
Yes, ma'am.
എത്ര നേരം വേണം? ഇതും കൂടി തീർക്കണം
10
എനിക്ക്.
minutes.
5 വരെ.
5 minutes. Okay.
Okay, ma'am.
5 minutes break.
Thank you, ma'am.
Okay, തുടങ്ങാം. കേൾക്കാമോ?
കേൾക്കാം മാം.
ഓക്കെ ഓക്കെ, സ്റ്റാർട്ട് ചെയ്യാം, അല്ലെങ്കിൽ തീരില്ല 4 മണിയാകുമ്പോഴേക്കും. So high altitude, the questions will be acclimatization, from acclimatization and adaptation. Okay, and high altitude illness rarely asked. Acclimatization ആണ് most important question. അതിൽ acclimatization ചോദിച്ചു കഴിഞ്ഞാൽ you should write adaptation also. Okay, ഞാൻ ഈ സ്ലൈഡ്സിലുള്ള പോയിന്റ്സ് എഴുതിയാൽ തന്നെ അത് വെച്ച് എഴുതിയിട്ട് പിന്നെ നിങ്ങൾക്ക് ടെക്സ്റ്റ് വായിക്കുമ്പോൾ എക്സ്ട്രാ പോയിന്റ്സ് വേണമെങ്കിൽ എഴുതാം. ഓക്കെ, അത്രേ ഉള്ളൂ. അറ്റ്ലീസ്റ്റ് മിനിമം ഇത്രയും പോയിന്റ്സ് എങ്കിലും എഴുതണം. Okay, I will give you the slides. So next topic is diving physiology, or physiology of high atmospheric pressure. Okay, so till now we were discussing about physiological changes occurring at high altitude due to low atmospheric pressure, isn't it? And when you go down, what will happen? From the sea level, when you descend or when you go down, there is increase in atmospheric pressure. ഇപ്പൊ താഴേക്ക് പോകുമ്പോൾ പ്രഷർ കൂടും. അപ്പൊ പ്രഷർ കൂടുമ്പോഴുള്ള effects ആണ് നെക്സ്റ്റ് ഡിസ്കസ് ചെയ്യുന്നത്. ഓക്കെ, and that is mainly seen in divers and also seen in caissons workers. Caissons and caissons എന്ന് പറഞ്ഞാൽ എന്താ? There are some workers which are working under sea during some construction works like underwater tunnel. ഈ ടണലൊക്കെ പണിയുന്ന സമയത്ത് വർക്ക് നടക്കുമല്ലോ, അണ്ടർ സീ യു ഹാവ് ടു വർക്ക്. The person have to go under sea and they have to work under high pressure atmosphere. Okay, and in those cases what are the physiological changes and what are the problems that can occur under sea and also during ascent to sea level from depth? And these are the things we are going to discuss. And this is also used usually asked as a short essay, and that is dysbarism. പല പേരിൽ ഇതിന്റെ question വരാറുണ്ട്. That I will tell you when we discuss about decompression sickness. Okay. And what are the effects of depth on volume of gases? What will happen when you go downwards or under sea? And here you can see when you go down, there is increase in atmospheric pressure. And what will happen when there is increase in atmospheric pressure? When the pressure is increased, the volume of gas which is compressed will be decreased. And that is called Boyle's law, isn't it? The plus 2 Boyle's law states that volume to which a given quantity of gas is compressed is inversely proportional to pressure. So when the pressure increases, the volume of gas will decrease. Okay, you can see that at sea level, it is 1 atmospheric pressure. And it is at 33 feet down, it is 2 atmospheric pressure. And when where you can see when the volume of gas is 1 liter at sea level, that will be decreased to half liter at 33 feet. And at 100 feet, it is 4 atmospheric pressure. So the volume to which the gas is compressed is reduced to 1/4 liter. Okay, and what will happen to solubility of gases? So the effect of depth on solubility of gases. According to Henry's law, what is that? The quantity of a gas physically dissolved in a liquid is directly proportional to the partial pressure of the gas. Okay, and dissolved gas is solubility into partial pressure. Solubility കൂടുമ്പോൾ partial pressure കുറയും. Okay, അത്രയും മനസ്സിലാക്കിയാൽ മതി. And you can see some the solubility coefficient for various gases. Here you can see that the solubility coefficient is maximum for carbon dioxide. So the partial pressure of carbon dioxide will be less under depth, whereas it is less for nitrogen and helium. So their solubility will be solubility coefficient is less, so partial pressure will be more. And high atmospheric pressure, this condition is seen in 3 cases. That is, one is deep sea diving and caissons workers, and under the sea in submarines. Okay, these are the three conditions where you get where the person is exposed to high atmospheric pressure. And what are the changes? What is happening when a person descend beneath sea? And under sea, what is happening is that the atmospheric pressure around the person is increased tremendously, and so that person should breathe air at high pressure to inflate lungs or to keep the lungs from collapsing. Lungs collapse cheyadirikkanamengil, the person has to breathe air at high pressure. നമ്മൾ താഴേക്ക് പോകുമ്പോൾ നമ്മുടെ ചുറ്റുമുള്ള പ്രഷർ ഭയങ്കര കൂടുതലായിരിക്കും. അപ്പോൾ person has to breathe air at high pressure to inflate the lungs. ലങ്സിനെ ഇൻഫ്ലേറ്റ് ചെയ്യണമെങ്കിൽ അത്രയും ഹൈ പ്രഷറിൽ ബ്രീത്ത് ചെയ്താൽ മാത്രമേ പറ്റുള്ളൂ. And this exposes blood in the lungs to extremely high alveolar pressure called hyper, and this condition is called hyperbarism. Okay. And what are the physiological problems under high pressure? There are two problems that is occurring when the person is exposed to high pressure. And one is physiological problems at depth due to the compression effect. And second problem is physiological problems of ascent due to decompression phenomenon. അപ്പോൾ താഴേക്ക് പോകുമ്പോൾ ഉള്ള പ്രശ്നമുണ്ട്, അതേപോലെയുള്ള പ്രശ്നമാണ് മുകളിലേക്ക് കയറി വരുമ്പോൾ. അപ്പോൾ താഴെ പോയി കഴിഞ്ഞിട്ട് തിരിച്ചു കയറി വരുമ്പോൾ ശ്രദ്ധിക്കേണ്ട കാര്യങ്ങളുണ്ട്. അല്ലാതെ പെട്ടെന്ന് കയറി വന്നാൽ ഉണ്ടാവുന്ന പ്രശ്നങ്ങളുണ്ട്. താഴേക്ക് പോകുമ്പോൾ ആ ഡെപ്തിൽ എത്തുമ്പോൾ ചുറ്റുമുള്ള അറ്റ്മോസ്ഫിയറിക് പ്രഷർ കൂടുന്നത് കൊണ്ടുള്ള പ്രശ്നങ്ങളുണ്ട്. Okay, so when you go to depth, what is happening? There is compression effect. When you ascend, what is happening? There is decompression effect. Okay, so these are the two problems under high pressure. And physiological problems under depth. We will discuss physiological problems under depth. Of this, first thing is physiological problem due to mechanical effects of high atmospheric pressure. I told you there is increased atmospheric pressure around surrounding the person, isn't it? And this will have some mechanical effects on your body. And what are these mechanical effects? One is caving in of chest or chest feeling, caving in of chest, and damage to face, squeezing of air in the paranasal sinuses and middle ear. Middle ear air cavities, നമ്മുടെ ശരീരത്തിലുള്ള air cavities ഒക്കെ പ്രശ്നം വരും. അതാണ് ഈ മെക്കാനിക്കൽ പ്രോബ്ലംസ്. Okay, these are the areas where mechanical effects are seen: chest, face, paranasal okay, paranasal sinuses and middle ear. And what are the physiological problems due to high pressure on respiratory gases? And the most important changes at depth is due to the increased partial pressure of these respiratory gases. So the lungs will be exposed to high partial pressure of respiratory gases. Which are the respiratory gases? The gases in your air which is breathing, isn't it? The most three important gases are nitrogen, oxygen, and carbon dioxide. And we have seen that at high altitude, the problem was only due to low partial pressure of oxygen. The nitrogen and carbon dioxide were not causing much harm at high altitude. But under sea or under depth, what is here, almost all these gases, nitrogen and oxygen and carbon dioxide to some extent, are causing problems. And the most important gas which is causing problem under depth is nitrogen. Okay, nitrogen is causing problem under depth when you descend, and also it will cause problems when you ascend to height from depth. Okay, so first thing is under depth, nitrogen is causing a condition called nitrogen narcosis. What is happening here? When the person is going deep, the person will be using a breathing mixture, air mixture, and this air mixture will be containing 20% oxygen and 80% nitrogen. Okay, because inhalation of 100% oxygen at high atmospheric pressure will cause CNS depression. Hence, a mixture of 20% oxygen and 80% nitrogen is inhaled at high pressure. And at sea level, the pressure at sea level pressure or 1 atmospheric pressure, the nitrogen has no significant effect. But when the person remains under sea for an hour or more and is breathing this compressed air, symptoms of nitrogen narcosis will appear. And this nitrogen narcosis symptoms will first appear at 120 feet depth. Okay, 120 feet when you breathe this air mixture, there will not be much problem. The symptoms will first appear at 120 feet depth. And what are the problems? And what is the mechanism of this nitrogen toxicity? There is increased partial pressure of nitrogen. When the person is breathing this air at high pressure, that will cause increase in partial pressure of nitrogen. And at this high partial pressure, what will happen? This nitrogen will dissolve easily into body fluids and more easily into fats. That's the most important thing. When the person is exposed to, when the person is breathing nitrogen at high pressure, the partial pressure of the nitrogen will be more, and at this high partial pressure, nitrogen will dissolve in the body fluids more easily and much more in fats. Okay, body fluids dissolve കൂടുതലായിട്ട് ഫാറ്റിലും dissolve ചെയ്യും. And which is the tissue which is having maximum fat content? It is the neurons. Okay, neurons do have large amount of fat on the cell membrane as well as on the myelin sheath. You have which is fatty tissue, high lipid content. And so neurons are the most susceptible tissue. Okay, so neurons are the most susceptible tissues as cell membrane of the neurons contain high lipid content. And what will happen? This when the nitrogen is dissolved in these neuronal membranes, this will alter ionic conductance. So that will affect the action potential in the neurons. Okay, and that will decrease the neuronal excitability. And that is the reason for nitrogen narcosis. And what is the most important function that is affected under this nitrogen narcosis is intellectual functions. Okay, intellectual functions are altered. But the manual dexterity functions will be unaffected, but intellectual functions are altered. So neurons are the most important tissue, the mostly affected tissue with nitrogen. Okay. Mechanism of toxicity important okay. And what are the features of nitrogen narcosis? The features of nitrogen narcosis are similar to alcohol intoxication, and hence they are called, it is also known as raptures of depth. Okay, and what are the features seen? I told you that the symptoms first appear at 120 feet. And the features seen at this 120 feet, where the person is exposed to around 4 to 5 atmospheric pressure, the symptoms like euphoric symptoms, and the individual become jovial and carefree, impairment of mental functions are seen. And when the person goes deep at 150 to 200 feet, or when the person is exposed to 6 to 7 atmospheric pressure, there will be drowsiness, poor muscular coordination. Okay, and that is seen at 150 to 200 feet. At 200 to 250 feet, weakness and extreme fatigue, stupor, when the person will become stuporous. And beyond 250 feet, death can occur. Deep narcosis and death can occur. Okay, beyond 250 feet means the person is exposed to 8 atmospheric pressure, 8 times the pressure at sea level. Okay. These are the symptoms seen at different levels of nitrogen narcosis. And very short lasting dives do not resulting in nitrogen narcosis, because nitrogen will take some time to get dissolved in the tissue fluid and cell membranes or lipid fats. Okay, so very short lasting dives do not resulting in nitrogen narcosis. And how will you prevent this condition? It can be prevented by breathing mixture of oxygen and helium. Helium can be used in place of nitrogen. Okay, helium can replace nitrogen in the breathing mixture when the person goes for deeper dives. Okay, that is how you can prevent. But what is the problem with helium? Helium also has got some problems. When the helium will also cause some problems at deeper or when the person goes depth severe when the person is exposed to severe pressure, and that condition is called high pressure nervous syndrome. That is because of high pressure nervous syndrome is because of the effect of helium. Oxygen helium mixture at high pressure also cause problems called high pressure nervous syndrome, and this helium has got anesthetic effect at high pressure, and that condition is called high pressure nervous syndrome. Features are tremor, drowsiness, depression of alpha activity index. Just know the name of this condition, high pressure nervous syndrome, because of the effect of helium at high pressure. Okay. And one difference from nitrogen narcosis is that here the intellectual functions are not severely affected, but manual dexterity is impaired. Okay. And next is the oxygen toxicity. And oxygen toxicity at high pressure. The effect of oxygen, this effect is due to high partial pressure of oxygen. At high partial pressure of oxygen, here also what is happening? Large amount of oxygen will be dissolved in dissolved form. And normally, how much amount is oxygen is dissolved in the dissolved form? Aditya. Aditya Ashok. How much amount of oxygen is dissolved in the normal?
Normal 32 gram. 32.
In the 32. 32. How is oxygen transported? What are the two forms of oxygen transport?
It forms oxyhemoglobin compound with hemoglobin.
Oxyhemoglobin? Oxygen combined with hemoglobin in a dissolved form.
Dissolved form, plasmid.
Dissolved form ആണ് ഞാൻ ചോദിച്ചത് എത്രയാണ്? അതൊന്നും അറിയാണ്ടാണ് ഈ ക്ലാസ് കേൾക്കാനിരിക്കുന്നത്. വല്ലതും പറഞ്ഞാൽ മനസ്സിലാവോ? ഉറങ്ങായിരിക്കും അല്ലേ?
ചോദ്യം കേൾക്കില്ലായിരുന്നല്ലോ.
എന്താ
ഉറങ്ങുമായിരുന്നെങ്കിൽ ഞാൻ ചോദ്യം കേൾക്കത്തില്ലായിരുന്നല്ലോ. കൊണ്ട് ഉറങ്ങിയിട്ടില്ല.
ഓക്കെ എനിക്ക് സമയമില്ല, എന്നാലും ഞാൻ തീർക്കുമ്പോ അത് എത്രയാന്ന് പോയി നോക്ക് കേട്ടാ. ഞാൻ പറഞ്ഞു തരാൻ പോകുന്നില്ല. Okay, at high partial pressure at depth, what is happening? The person is exposed to high atmospheric pressure, and that will cause increase in partial pressure of oxygen also. And at this high partial pressure, what happens is that the amount of dissolved oxygen will be increased, and the normal oxyhemoglobin or hemoglobin oxygen buffering mechanism is no longer capable of keeping the partial pressure in the normal range. Partial pressure of oxygen in the normal range, and that will cause increased partial pressure of oxygen. And what happens when there is increased dissolved oxygen? There is the active forms of oxygen are called oxygen free radicals, and normally they are removed by enzymes like catalases, peroxidases, superoxide dismutase, etc. And when there is increased amount of dissolved oxygen or at high partial pressure of oxygen, these enzyme systems are getting saturated, and there is oxygen toxicity. Okay, and this oxygen toxicity is mainly because of these oxygen free radicals, and we will see the mechanism of oxygen toxicity, how this oxygen toxicity takes place. There is high partial pressure of oxygen, there is large amount of dissolved oxygen, and that will cause excessive intracellular oxidation or oxygen free radicals. And there is this free radicals will cause oxidation of polyunsaturated fatty acids of the cell membranes, as well as cellular enzymes. And these polyunsaturated fatty acids are more in the neurons. We have seen in the case of nitrogen also, it is affecting mainly neurons. This oxygen also, because of the free radicals, oxidation by the free radicals also affecting neurons because of the high lipid content. Okay, so neurons with high lipid content are more susceptible. So this is the mechanism of oxygen toxicity. And what are the features? There will be nausea, dizziness, irritability, disorientation, disturbed vision, convulsions. And how will you prevent this oxygen toxicity? Gas mixtures to be inhaled at high pressure with concentration of oxygen decreased to 20%. So breathing mixture la oxygen concentration korakya. Adana idillulla vali. Okay. Gas mixtures with concentration of oxygen decreased to 20%. That is how you can prevent this oxygen toxicity. And next is carbon dioxide toxicity. Carbon dioxide toxicity, usually depth alone does not cause increase the rate of carbon dioxide production in the body. Usually carbon dioxide toxicity does not occur unless the carbon dioxide removed from the body is rebreathed. Okay. Now, we exhale carbon dioxide. Normally, carbon dioxide toxicity. When the person going deep usually uses a particular breathing apparatus, and that breathing apparatus has got several valve systems, and these valve systems will remove carbon dioxide. Either it will be removed outside, removed to the external environment, or this carbon dioxide exhaled from the person will be absorbed in the apparatus itself. Okay, breathing apparatus two type of systems ഉണ്ട്. Open system, closed system എന്ന് പറഞ്ഞ two type of apparatus available ആണ്. Breathing apparatus the carbon dioxide is usually removed by two ways, two mechanisms. One is it is reabsorbed within the apparatus, or it is exhaled, or it is removed into the external environment. Okay, in this diagram, can you see bubbles are coming out of that? One person is diving, and you can see that breathing apparatus, and the bubbles are coming. That is actually due to the carbon dioxide. Okay, and when there is any problem with the breathing apparatus, the carbon dioxide is not removed properly, that can cause carbon dioxide toxicity. Okay, carbon dioxide buildup occurs when the person rebreathes the carbon dioxide which he or she produces, and this will happen in the absence of an apparatus which absorbs carbon dioxide or release expired carbon dioxide into the atmosphere. And the maximum tolerated limit is alveolar partial pressure of carbon dioxide of 80 millimeters of mercury. So up to 80 millimeters of partial pressure of carbon dioxide in the alveoli, there will not be much problem. When the partial pressure increases to 80 millimeters, there will be problems or carbon dioxide toxicity. And what is the effect? And respiratory center is actually depressed when there is high partial pressure of carbon dioxide. Okay. And next, so that finishes the physiological problems under depth. Okay, physiological problems under depth included two categories. One is mechanical effect due to increased pressure, and the second is increased pressure due to pressure of respiratory gases. Effect. Okay, and next physiological problem is problem of ascent. That is the person who is ascending from the depth, who is ascending rapidly. There will be problems, and two problems are seen. One is decompression sickness, and the second is air embolism. The decompression sickness usually asked as a short essay. Short essay on physiological basis ചോദിക്കാറുണ്ട്, short essay ആയിട്ട് ചോദിക്കാറുണ്ട്, എല്ലാം important ആണ് കേട്ടോ, വൈവയ്ക്കും ചോദിക്കുന്നതാണ്. Okay, what is decompression sickness? This decompression sickness has got several other names. It is also known as dysbarism, diverse palsy, Casson's disease, the bends, the chops. ഇത്രയും പേരുണ്ട്. ഇതിൽ ഏതായിട്ട് വേണമെങ്കിലും പരീക്ഷയ്ക്ക് ചോദിക്കാം. ഡിസ്ബാരിസം എന്നൊക്കെ ചോദിക്കുമ്പോൾ ചിലപ്പോൾ നമുക്ക് എന്താന്ന് തന്നെ ഓർമ്മയുണ്ടാവില്ല. Okay, it is decompression sickness. Dysbarism. Dysbarism എന്ന് ചോദിക്കുമ്പോൾ വേറെ ചാപ്റ്ററിൽ നിന്നുള്ള ആൻസേഴ്സ് ഒക്കെ എഴുതാറുണ്ട് പലരും. എന്താണെന്ന് മനസ്സിലാവാതെ. Okay, dysbarism എന്ന് പറഞ്ഞാൽ increased pressure എന്നുള്ളത് ഓർമ്മ വരണം. And dysbarism is nothing but decompression sickness. Okay, another name is diverse palsy, then Casson's disease, the bends, the chokes. But this decompression sickness occurs when a subject exposed to high atmospheric pressure are suddenly brought to low atmospheric pressure, as seen in sea divers who rapidly ascend to sea level, and also seen in cases of sudden ascent to high altitude from sea level in an unpressurized cabin. Okay. And what is happening in this decompression sickness? The diver is usually, or the person who is diving is breathing 80% nitrogen, and this person is descends to deeper sea. And at this deep sea, what is happening? The nitrogen will be dissolved in body fluids and lipid structures of tissues. The nitrogen is not metabolized in the body. So the nitrogen will be in the dissolved form inside your body under sea. Nitrogen will be dissolved under high pressure. Okay, and nitrogen will be remaining as such in your body fluids, dissolved. And next, what happens? The person ascends to a high altitude or to the sea level rapidly. Rapid ascent, what happens? The partial pressure of nitrogen falls to normal level. And at this stage, what happens? The nitrogen will diffuse from tissues into the lungs along partial pressure gradient. But external atmospheric pressure കുറയാണ് പെട്ടെന്ന് മുകളിലേക്ക് കയറി വരുമ്പോൾ അപ്പൊ എന്ത് സംഭവിക്കും നമ്മുടെ ടിഷ്യൂല് nitrogen is dissolved under high pressure. So there is partial pressure difference or gradient from tissue to the alveoli. And with this partial pressure gradient, the nitrogen will suddenly diffuse from the tissues into the lungs. And during rapid ascent or rapid decompression, this nitrogen will escape from solution very rapidly in bubbles. And these bubbles are formed in tissues causing symptoms. Okay, അപ്പൊ എന്താ സംഭവിക്കുന്നത്? നൈട്രജൻ നമ്മുടെ ടിഷ്യൂല് ബോഡി ഫ്ലൂയിഡ്സിലും അല്ലെങ്കിൽ ലിപ്പിഡ്സിലും എല്ലാം ഡിസോൾവ് ചെയ്തിരിക്കുകയാണ്. Dissolve ചെയ്തിരിക്കുന്ന nitrogen, when you are exposed to low atmospheric pressure or when the person rapidly ascend to sea level, താഴേന്ന് പെട്ടെന്ന് ascend ചെയ്ത് മുകളിലേക്ക് വരുന്നു. അപ്പൊ എന്ത് സമയം പെട്ടെന്ന് rapidly you are exposed to low atmospheric pressure. So in dissolved nitrogen at high pressure will be rapidly removed through the lungs. It will try to rapidly escape from the tissues, and this escape is occurring as bubbles. Okay, this nitrogen will escape in the form of bubbles. So bubbles പെട്ടെന്ന് bubbles ആയിട്ട് വരുമ്പോൾ എന്ത് സംഭവിക്കും? എല്ലാ ബബിൾസിനും പെട്ടെന്ന് ലങ്സിൽ കൂടെ റിമൂവ് ചെയ്യാൻ പറ്റില്ല. പലതും ബബിൾസ് are formed inside the body tissues at several locations. പല സ്ഥലത്ത് നെർവ്സിലും മസിൽസിലും ജോയിന്റ്സിലും ഒക്കെ ഈ ബബിൾസ് ഉണ്ടായി വരും. Nitrogen bubbles are formed in your joints, muscles, nerves, neurons, like that. Okay, and these bubbles formed at these different locations are causing problems. Okay, and during gradual ascent, what happens? Gradual decompression, these gases which come from solution are eliminated through lungs slowly, and so that will take time to remove nitrogen from the tissues, and that will not cause much problem when the person is ascending gradually. Okay, but the problems എല്ലാം rapid ascent വരുമ്പോഴാണ് സംഭവിക്കുന്നത്. Okay, so symptoms are due to gas bubbles escaping rapidly from tissues. The gas bubbles block blood vessels, producing tissue ischemia and tissue death. And what are the symptoms seen? Different symptoms are seen, and these different symptoms are the reasons for different names of this disease, decompression sickness. You can get pain in joints and muscles of legs and arms, and that is accounts for the name the bends. Okay, and the pain is due to escape of bubbles from the myelin sheath of sensory nerves supplying the joints. And sensation of numbness can be seen because of the neuronal involvement. You can get tingling, pricking, itching sensation. And chokes means dyspnea. The bubbles in the pulmonary capillaries causing dyspnea. and bubbles from myelin sheath to sheath of motor neurons or bubbles in the arteries to brain and spinal cord can cause paralysis, and hence the name diver's palsy. Okay, and bubbles in coronary arteries can cause myocardial damage, myocardial ischemia, chest pain can occur. Okay, and how can you prevent this decompression sickness? It can be prevented only by gradual ascent to high altitude. And how will you treat? Suppose the decompression sickness or this happens. How will you treat? The person rapidly ascend to sea level and the decompression sickness symptoms are seen. How will you treat? Tank decompression is used. What is meant by this tank decompression? There is a compressed or pressurized tank where the person is put into that tank, where the person is again exposed to high atmospheric pressure, and that will cause recompression to dissolve the nitrogen bubbles. Appo ee person ne oru tank ennu panna oru compressed air chamber aanu, adilekku maattiittu avade the person will be exposed to high pressure, and the bubbles which are formed inside the tissues are to be again dissolved into the body fluids. Okay, for that you are applying high pressure, and recompression is given. Okay, and this is followed by slow decompression. When there is slow decompression, the nitrogen is removed without much harmful effects. And how do you remove? How will you do this slow decompression? It is by 2/3 of nitrogen to be removed in 1 hour and 90% in 6 hours. And this is a tank decompression. I mean, pressurized tank. You can see there is a large multi-compartment recompression chamber. Okay. Next, that is about the decompression sickness. So when you are asked to write about decompression sickness, you have to write about the mechanism of or physiological basis of decompression sickness, and what is the cause, what are the features, and how will you prevent and how will you treat. Okay, and next problem of rapid ascent is air embolism, and the mechanism is almost same. What is happening here is the entry of air into blood circulation can occur following rupture of pulmonary capillaries or arteries and veins caused by sudden expansion of gases in the lungs. The same mechanism, the gases which are dissolved in the tissues will be expanded suddenly on exposure to low atmospheric pressure. Okay, and these expanded gases will cause rupture of pulmonary capillaries and arteries, and veins. Okay, and this can cause air embolism, and air will be entered into circulation, and this air can reach your brain or heart or any areas in the body, and this can occur when a person suddenly ascend holding his breath. And the features of air embolism are chest pain, tachypnea, systemic hypotension, and hypoxemia. And how can you prevent these physiological problems of depth and ascent? And two mechanisms and two conditions for short duration dives and for deeper dives. For short duration dives up to 20 meters, the person can be asked to take rapid deep breaths before diving. And by this way, you can prevent these problems. But for deeper and longer dives, you have to use breathing apparatus. And one breathing apparatus is called scuba diving. I will show you a diagram of scuba and picture of the scuba. And another mechanism is use of breathing mixture containing helium and low oxygen concentration. Okay, and then most important thing is slow ascent and decompression table. Decompression table means a chart showing the procedure of decompression or procedure of ascent. How much time you should take for ascent from a particular depth. And for that, decompression tables are available. I show you. This is a picture showing scuba. This is a scuba breathing apparatus. The full form of scuba is self-contained underwater breathing apparatus. Okay, this has got several valve systems And here 2 air cylinders are shown, which contain the air or breathing mixture under high pressure. But the valve systems will allow the person to breathe air with low pressure. Okay, valve system will decrease the pressure of this air breathing mixture, and will so the person can breathe air with lower pressure. Okay, that is a peculiarity of this apparatus. So the person will not be exposed to much higher pressure with this apparatus. And this is a decompression table showing how to ascend ascend to sea level from a depth of 190 feet. The person is remaining at 190 feet for about 60 minutes. Okay, the diver who has been breathing air and has been on the sea bottom for 60 minutes at a depth of 190 feet is decompressed according to this schedule. You can see the person should reach 50 feet depth in 10 minutes, then 40 feet depth in 17 minutes, 30 feet depth in 19 minutes, 20 feet depth in 50 minutes, and 10 feet depth in 84 minutes, like that. Okay, and so this ascent should be slow. This is how the decompression tables are used for ascent, slow ascent of the diver. Okay, so that finishes diving physiology. So decompression sickness is important. So what are the problems of depth? And we have seen high altitude and diving physiology. What are the problems at high altitude and what are the problems at depth? And both these, in high altitude physiology, the acclimatization is usually asked as a short essay, and also for physiological basis question. Diving physiology, the decompression sickness is usually asked. Okay. So thank you. And you, any doubts? Doubt and arguing. ഹലോ, പോയോ എല്ലാവരും?
ഇല്ല മാം. ഇല്ല മാം.
വീടായിരുന്നോ? Okay. Next week I will be, I think I will be taking hypoxia, different types of hypoxia, and different applied aspects of respiratory system. Okay. So before attending that class, you should read this high altitude and diving physiology, and other than this, you have to learn regulation of respiration and transport also. Okay. അത്രയും വായിച്ചിട്ട് വേണം വരാൻ, എന്നാലേ വല്ലതും മനസ്സിലാവുള്ളൂ ഹൈപ്പോക്സിയും അതെല്ലാം പറയുമ്പോൾ. Okay.
Okay ma'am. PPT ആയിരുന്നേ. PPT അയച്ചായിരുന്നേ.
അതുലാണോ?
Yes ma'am.
Okay. അയച്ചു തരാം. അങ്ങോട്ട് കിട്ടിയിട്ട് വേണം പഠിക്കാൻ അല്ലേ?
ഇടയ്ക്ക് വെച്ച് അവിടെ ഇവിടെയൊക്കെ മിസ്സായിട്ടുണ്ട്.
ഉറങ്ങിപ്പോയോ?
അല്ല, സ്പീഡ് കൂടുമ്പോ ഇടയ്ക്ക് വെച്ച് മിസ്സായി പോകും.
Okay, I see that. Okay, shall we stop?
Yes ma'am.
Okay.
Yes ma'am.
Okay.
Thank you, ma'am.
Thank you, ma'am.